The Affordable Care Act was signed into law on March 23, 2010 to reform care in America. The new health care law includes reforms to the affordability, quality, and availability of health insurance and new cost-cutting measures, rules, and regulations for both public and private health insurance companies. The Affordable Care Act has been highly controversial despite the positive outcomes. Many people object to the tax increase and higher insurance premiums needed to pay for the Affordable Care Act. Some people in the health industry are critical of the additional workload and costs placed on medical providers. They also think that they may have negative effects on the quality of care. The Affordable Care Act is subject to changes every year. The legislation can be amended and the budget decisions can affect how it is implemented. Changes in the healthcare field, along with the changes in the political makeup of future presidential administrations and Congress, make it likely that the Affordable Care Act will be tinkered with for many years to come.
So we frankly look at how do we improve the system first and foremost, and our presumption is if we transform the system, that will drive significant cost improvements and service enhancements. And so we focus on things like putting a lean structure in place that really engages staff that are doing the work, that engages managers to manage differently, that their approach is your job isn't to tell people what to do, your job is to facilitate performance improvement across the organization. And so we started with training our executives and training our middle managers and our medical staff leadership to think differently around system transformation, not just one-time costs.
Would be what I would call double dipping. The patients that I see that come in not only getting tests performed for their GP, but also the same tests repeated for cardiologists, nephrologists, anything like that. Patients are seeing multiple doctors getting the exact same test run.
In the United States, obesity is a big problem, and there's so many things that have led to that, including just the food industry and just the sedentary lifestyle of Americans, and you know, looking at the cost of health care in relation to diabetes and the you know, the problems with it.
Means is that healthcare will come to represent a larger part of our economy, and that's what we've seen over the last few decades. That it used to be, one out of every $10 was spent on healthcare, and now it's more like 1 out of every 5. And in some ways, that makes sense. As a country gets richer and as people get richer, and they think about what are their priorities that they want to spend their money on, being healthier and living a longer and more comfortable life, that actually seems like maybe a pretty good thing to spend your money on. But there, of course, comes a point at which healthcare spending represents so much spending that it's really crowding out other things that people want to spend their money on and that the government wants.
Number 2, drugs, and what I mean by drugs is prescription drugs. A little bit of a touchy subject here is have to research the effectiveness and cost of different treatments. When you look at prescription drugs are just given and think that's the end-all, be-all, that it's going to solve the problem. Typically, when you're put on a prescription, you're on it for life, unless it's something acute, such as a antibiotic, what the case may be. But really, when you see an increase in drug costs, and I think there's a lot of initiatives being put into place to help that. Life-saving drugs are not affordable in this country. If it's a compound drug or something of that nature, it could be upwards, without exaggerating, say $30,000 a month. Unfortunately, insurance comes in to pick a lot of that up, or however that's negotiated out. But again, that drug has to be paid.
Hospitals and fees to insurance companies and their fees. I think everyone wants to get a piece of the pie, but everyone wants a piece that's too big. And I don't know where to start. I think some sort of government intervention is necessary, but I think too much government intervention is, can lead to the demise of good health care.
And I would like to see a universal tax credit, give everybody the same amount of help for health insurance, regardless of where they get it. Make sure it is not affected by how people work or how many hours they work or how much they earn. Really universal. And then let government back up and get out of the way, let people make their own choices, let the market compete.
I believe in universal health care. However, Americans are spoiled by generous healthcare companies, retirements. They're used to getting what they want and not having to follow the proper procedures. Universal health care would be wonderful if people would learn that not everything is an emergency.
Good initiatives by the government to try and help those less fortunate and those with less access to care. But with these good intentions and the programs that the government has set up, people also seem to tend to take advantage of those programs.
As America stands for, what America stands for, what you hear on television, what we're taught in school all the way up until we're out of school is that control, it's our right. You're seeing that shift with us as Americans being offered more health savings accounts, more choice in what we're doing. Going out there and having the ability to look at physicians and see, just like you would at a restaurant, you're getting to see the comments made about them and the ratings from other patients that have visited them. And when individuals have control, statistically speaking, costs go down and quality goes up. We're in control. We pick what we want. We pay what we want, and that's ultimately the goal: is the healthcare costs go down and the quality of care.